Amy has been an incredible supporter and her team of this event since day one in 2022. They have made clean boxes available to the exhibitors out here to make sure that you're putting your heads in clean headsets, and she does that of her own accord. So thank you so much for that, Amy, and the support you've given to VA to keep us all clean and healthy. So we'll hand it to you.
Thank you, Ann. Thanks, everyone. It's great to be here today, although anytime I hear somebody read my bio, I kind of want to shrink and say, who wrote that? Feels like more to live up to than I ever really wanted to live up to, but it's great to be here today. Ann introduced me. I will say I had something completely different prepared a week ago that I was going to share with you. I wanted to talk about some of our client use cases and successes, especially in healthcare. We're in 15 different industries, so there are so many lessons that can be learned from one and applied to another. But you guys all know a lot of this data because you guys are all at the forefront of this movement. All of you guys are experts in this already. So I thought maybe instead, with encouragement, of course, from Lorenzo and my team, I'll tell you why I'm here, where I came from, and why this is so important to me. So heads in clean headsets. Thank you guys for making the hashtag heads in headsets, which of course I had to add the word clean to, because that's critically important for all of us to want to use VR over and over again. But I feel privileged to be here with all of you. It's kind of not the greatest acoustics in here. You guys can all hear me in the back? Everything's clear? Okay. Not overwhelming. So where did I come from and why am I here? Well, first of all, we're here because we're innovators and we're here to change the world. And we're doing it through the lives of the people that matter to us and the other people in this room. So everybody here, I believe, is an innovator. And an innovator means that you're starting from scratch with an idea or a goal or a need or something that's missing. And you're saying, there's got to be a way to fix this. There's got to be a way to make this better. That's why we're all here. And of course, technology advancing can enable us to do more things for the people that we love and care about. So innovation, though, takes time and patience. And I know some of you here, especially those who are friends of mine who've been in this industry for decades, could say that you understand that very much firsthand. Can I just play this video? Just play here? Is it gonna play? Oh, can you guys hear that? Oh, let's go back. Can you just, there we go.
What is that?
That's a washing machine.
What does it wash?
Clothes.
Can you imagine?
An electric motor spins the cylinder as water is pumped through the machine. Soap is added here, and the agitation removes any soiling.
What does that wash?
That's a refrigerator. The top compartment keeps food frozen, and the bottom compartment maintains a temperature of 38 degrees.
And you sell these?
We rent them.
So you sell electricity, and then you rent all the things that need electricity?
More or less.
We don't need any of these things.
Well, the conveniences. Their use gives you time to do other things.
What other things?
Well, like other chores.
So you invent machines to do those, then what do we do?
Go on a picnic. Go for a swim. Go to the cinema. You can enjoy a...
So you get the gist. Has anyone seen 1923, which is the prequel to Yellowstone? Great show. But I think what really is being expressed there, of course, is that innovation is always a new idea at some time. Anything new, anything good, any progress is always met with resistance, is always has a time that people have to get adjusted to change, and it takes people like everyone in this room to make that happen. So I'm sure you guys all can relate to some of the things that we just saw up there. So it requires an enormous amount of effort, persistence, and sacrifice. Now, I can tell you how many in this room sometimes have felt like, you know what, this is so much work. Maybe I need to give up, take a pause, take a break. Maybe it's not going to happen. Maybe somebody else could do this better. Anybody besides me ever feel that way? Oh, good. I was afraid I was going to be the only one to raise my hand. But that's what it takes. You have to keep going. And I can tell you, people in their big success stories down the road, well, you know, I just never gave up. But I can say that that's not true. I have given up many, 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 many times, over and over and over again. And then I wake up the next day and I'm like, all right, I'm still here. Let's keep going. Let's see what happens today to make it better. And that is why there's progress. That is why the VA was able to go from, I think, 1,200 headsets a year ago to 3,500. Double that number, because each of you got up the next day and kept going. And collectively, we've all been able to advance this entire industry and healthcare and user experience and patient experience and people's individual lives. So when I started out, I didn't think I'd be here today. Now this is going back, I won't give you the exact year that this is, but let's just say it was a long time ago, in the maybe early 20s, maybe the late 90s. I won't go back that far though. This was a different life. And I have a very eclectic background for those of you who don't know. I am not a scientist. I am not a doctor. I have done many, many things in life that have brought me to where I am today. The last 10 years have definitely aged me more than the first 20, but that's okay. But I started out, this is from a previous life, and I was very, very passionate about the arts. Storytelling, I'm a classically trained musician from a very early age. I've been very much involved in many sides of the artistic world, but that also is what drove me to becoming involved in XR 10 years ago. And by the way, this is me singing the national anthem for a Jets game. So I hope you don't hate the Jets, but you know, you got to give them some little bit of love sometimes. They don't get it much. And of course, back then my dream was, you know, how do I do this and also be a brain surgeon? I graduated high school very early. I had got accepted into pre-med when I was 16. I wanted to be a brain surgeon, but life took me another direction. But that being said, there was always a real drive to make people's lives better. How can you do that? How can you do that in a practical way through the arts and technology and education? So back in 2015 was my first head in a headset moment. It was a moment, and you can see here, this is one thing that you can love about Facebook, it reminds you of all of the thoughts you had 9 years ago. And this was at Mobile World Congress in Barcelona, Spain, and I tried my Oculus Quest on, and immediately I thought, I'm looking at the future, because this will change the way, it can change the way we learn, we engage with history, we engage with all the arts and all the sciences. And you know, when you go to a museum, for example, some of us love to read the plaques and many of us don't. Some of us remember everything they say. I'm not one of them. I remember the things that I engage in, the experiences that I have. And if I have an experience that's immersive, I will learn from that, like many of you, in a different way. And it'll stay with me physically, mentally, emotionally. And I'll have something different to pass on than just memorize words. And that is really what I truly thought would change my life and really the world around us. Of course, I didn't know it would be as hard as it has been, but I do believe it is transformative still. So at this point in time in my life, I was working with a corporate think tank. We were starting to write about changes in technology, how they were starting to think about global consumer behavior, large organizations, you know, what is the consumer going to be expecting in 10, 15 years? And how should we start thinking about that right now? Because it takes a lot of effort for those big moving machines, government, let's say, to execute change, to think about change, to then consider change, then to implement it, then to pilot it, then to actually scale it and execute it. So the future, of course, is what I was thinking about. And so what I did, if you recall in a previous life, after music and all of that, I also was living between New York and Los Angeles and working in film production. We were working on a project about the Wright brothers, and the goal was to be able to share that really incredible story of innovation and vision. And so back in the day, I was quite bold, and I went and introduced myself to the head of Air and Space Museum, and I became very, very good friends with many people at various of the Smithsonian institutions, various members there. And so I thought, this technology, this immersive technology, could actually really impact the way people engage in these museums. I knew at the time that over 90% of their artifacts were never, ever able to be physically displayed. That's a lot of knowledge and history and information that we didn't have easy access to. So I pitched this big idea, And you don't recognize this location because unfortunately we were not able to execute on it. After 18 months, we got almost there. But this was the idea, to take this and use their content and create an immersive experience that started out immersive before you got into this big VR immersive theater, and then of course put on headsets that would fully immerse you into whatever experience we were looking at, whether it was history, geography, nature, and so on. That was the original vision. But the first thing that I was asked was, okay, how are you going to do this? Who's going to pay for it? And surprisingly, one of the first questions I was asked is, how are you going to clean these things? Well, like, that's a good question. I guess I hadn't really thought of it like that. And the person said, who was a senior at the museum, said, we can't take the risk. We can't put these things on people's heads if we know that these people are coming from around the world. We don't know what hygiene standards there are. We don't know what kind of sicknesses could be going around. But this is their face, and people will get sick that way. That's a good question. So I guess we're going to have to use a bunch of wipes. And so this was a very big learning experience for me, a big moving moment where I had to think about this practically. I learned at the time, you can't just use a wipe without leaving it wet for 4 to 10 minutes on a surface. I had no idea before then. And then you start to think about that. That's fine. You've got 100 people using this. But if your goal is to scale this, you have 1 million, 10 million, 500 million people in someday using these headsets, that's not practical. So what is another way we could do this? Nothing existed at the time that didn't damage the headsets and didn't require tons of hours of labor and extra people. So we started developing CleanBox. Now, UVC has been around for a while. For those of you, I'm sure many in this room are familiar with that. It's been known to be a disinfectant for over 100 years. It's been used in healthcare and other settings in many ways, UV, from UVA, B, and C, to curing, to disinfection, UV robots in hospitals. And what has changed, though, over the last 50 years a bit is form factor. You have UV bulbs moving to xenon bulbs, and then about 10 years ago into LEDs. Now, the reason this mattered is because this transition, again, advancements in technology that somebody said, I'm going to make happen, allowed this to be used in a way that wouldn't have to require heat. It could be designed for consistent surface coverage and many other form factors and ways that you could use this very specifically and for specific purposes. But in 2016, LED technology was just emerging. So it was very, very nascent, and we started with our first patent in 2016, developed a working prototype, and in 2018, this is me way back in the day with units that don't exist anymore, but they were working prototypes that I traveled around the world with and told people, hey, what you're doing is magical. I'm going to help you make it scalable. And of course, I experienced things that probably a lot of you have as well. Some people ridiculed me endlessly. I had some people walk up and say, this is BS, and just walk away. And some people said, you're never going to do anything with this, and then walk the other way. And, fortunately at the time, I was like, going to let it go right over my head. I'm just going to keep going. That gets to you sometimes, though. But I kept going, and then we started traveling around the world with this prototype. So you keep moving on. And then in late 2019, we launched our first product, which is probably what everybody's the most familiar with if you know our company. It's back there in the corner. You can see a very early version of the CX-1. And then after that, then the world shut down. And we had COVID-19. And people were like, oh, this is such a great idea. I'm glad you existed because of COVID-19, which, of course, that's not why we existed. We were thinking about all the other things like pink eye and norovirus and all those other things that make us sick every day. But of course, we were like, okay, let's do this. We've got our product. We've already got it certified and validated. And we said, what else can our technology do? So some of the companies that had bought our product early on said, can we use this to disinfect N95 masks? And officially, there were only a few certified ways of doing that at this time. But in 2020, we thought, actually we can, because COVID is actually, for surfaces, a lot easier to kill than other things like MRSA or C. diff, for example. And so we got into a BSL-3 early on. We were able to introduce this product and help other companies use our existing products to keep their first responders safe. So moving forward, I don't have a time up here 6 minutes. Okay. Then we kept moving along, and I'll just I'll wrap it up quickly because the important part is less about the product and more about the innovation, more about taking things from concept to scalable execution. And that's where a lot of innovation dies. It dies between that very beginning process where everybody is the champion and everybody's excited to actually figuring out how are we going to make this scalable? So I love what everybody's spoken about this morning, from Dr. Kirsch to the ladies that were just up here, because it really is about scalability in the end. 2023, we launched our second OmniClean, and we began our 510K process. And then 5 years in a pandemic later, we have over 70 global patents in the use of UVC LED disinfection. We have over 2,000 enterprise clients and 4 products that we actively sell that are all made here in the United States. So some of the lessons learned in this process of innovation and execution. Remember your why. Why are you here? Focus on your customer or your client's return on investment. Collaborate and partner. We are still a very, very early, quite immature industry in many, many ways, and this is why collaboration and partnership are so critically important, and why the VA has done such a fantastic job of basically acting as an incubator for everybody's, all these champions' ideas here. And pay it forward. How are the ways that we've done this? Okay, know your why. Heads in headsets, heads in clean headsets. Keeping people safer. Reducing environmental pollution and giving people easy ways to do the things that support everything that you're doing out there. Focus on that client's return on investment. We can show return. So for us, our return on investment is cost savings, it's time savings, it's reduction in risk and reduction in environmental disposables. Collaboration and partnerships. We have over 80 solution partners worldwide that we work with on a regular basis. These are some of the ones that are here outside, and if you haven't seen what they're doing out there, please go see. It's fantastic. This is another cart we have there. It's one of our collaborations with Mind Immersive. And again, this is our way of saying what could help you help your patients? What could help you execute and implement VR in an easier, simpler way? And pay it forward. As Anne mentioned, we do try to provide as much as we can to people, especially startups. Some startups, are still bootstrapping. I've done that. I did that for the first 3 years as well. So we try to make this available so that you can still provide your services and do it in a safe, clean way. Necessity is the mother of invention, as they say. They forget to tell you the rest about how hard it is, but this remains true. It's the mother of invention. And so, coming from my goals as a kid, my whole career path that I planned when I was 13, and I was telling everybody, my dad, this is what I'm going to do, and you're going to pay for it. And he said, nope, you're going to pay for it. And he was right. To where I am today. Necessity is the mother of invention, and following that path wherever it takes you, I think is really, really important for us to even keep in mind. As a nascent industry, we're going to have to pivot over and over again. Things are going to work, and then they're not going to work. So figuring out and saying, what's my why? Going back to my why, going back to collaboration, going back to partnerships and incubating those ideas with other people is going to be critically important for whatever you're doing to be successful and to scale along with everybody else. So of course, I love that, I think this was on Dr. Kirsch's presentation as well, the same picture. So, but this is why we're here. And the VA, I want to say thank you to everybody at the VA for all the work you're doing and all the ways you've helped CleanBox, not just us, but everybody else here. It's been truly remarkable to see such an entity such as yourselves be so collaborative and innovative. And of course, these are the other ways. I know I'm short on time and I'm getting the hand, so I'll wrap it up. But promoting innovation, not from the VA down, and I hope that we all can keep this in mind as we work together. Is continue to promote innovation across each other's workspaces, developing guidelines and standards, which will be very important. So the guidelines that we create now will help create the standards in the future, and expanding opportunities. And on that part, I wanted to also thank the Charlie Norwood VA Medical Center for working with us on our CRADA and helping us find places where we can be successful and where actually we can provide the best use case for the people using our products. I really appreciate your time today, and thank you for having me.